free to use that Q&A feature, and we can bring the questions up as we go. Without further ado, I'd like to welcome Laura Martin from MedStar Georgetown University Hospital, who will present their poster titled Clinical Nurses Promote Safety in Oncology Patients by Reducing CLABSIs. Laura, take it away.
Thank you, Gail. As Gail mentioned, my name is Laura Martin. I'm the clinical educator for hematology, oncology, and bone marrow transplant at MedStar Georgetown University Hospital, and I'm going to be presenting about clinical nurses promoting safety in oncology patients by reducing CLABSIs. Next slide. So our clinical concern was that on the hematology oncology stem cell transplant unit, over a 13-month period, we had 9 central line associated bloodstream infections. This is a rate of 2.41 CLABSIs per 1,000 patient days. During this time, we were seeing a growth in our bone marrow and stem cell transplant program and had just begun doing allogeneic stem cell transplants. Next slide. So the goal of our project was to determine if nursing-focused interventions would decrease the incidence of CLABSIs on the hematology oncology stem cell transplant unit. So the objectives are to describe CLABSI risk factors pertinent to patients receiving chemo and/or stem cell transplants, to describe interventions that can be implemented to improve central line care and reduce CLABSIs, and to identify next steps that may be useful in other organizations working to reduce CLABSIs. A little bit of background. So oncology patients are really at an increased risk for infection. The patients on our unit are getting lymphodepleting high-dose chemotherapy, really wipes out their whole immune system. A lot of our patients are getting radiation either as a part of their cancer treatment or as preparation for their stem cell transplant. We see high doses of steroids prior to chemotherapy and as immunosuppression following transplant. Our patients also may be on other immunosuppression meds following their stem cell transplant. And many of our patients have prolonged central line use. They're admitted with central lines, they have their central line throughout their stay, and many of the patients will also go home with those lines. The effects of CLABSIs are that they can increase our hospital length of stay, they can increase healthcare costs, and most importantly, they can lead to poor patient outcomes. Because nurses are the primary providers caring for central lines in the hospital, we thought it was really important to focus on nursing interventions to reduce central line infections. So we put a number of interventions into place over a 4-month period, starting with the formation of a unit-based CLABSI reduction task force. This task force included unit nursing leadership, infection preventionists, and really most importantly, clinical nurses on the front line. The group researched best practice, working with our university librarian to look at the evidence. I provided re-education and revalidated all of the staff performing central line dressing changes and changing needle-free ports. We implemented a 2-nurse dressing change for all central line dressings to make sure that we were holding each other accountable and really ensure sterility throughout the process. We implemented weekly audits, looking at the line itself, looking at documentation and the environment in the room. We created new signage, new job aids, and really importantly, we continued staff education. We made this an ongoing conversation. These are some examples of some of the things that the task force created, from our audit to signage to some of our education, trying to be fun and keep everyone engaged. So I'm pleased to say that since our intervention, there have been only 2 CLABSIs on the unit. So this is almost 3 years. Our CLABSI rate was reduced from 2.41 to less than 0.3. 0.3 was our rate as of March. So since then, our rate is even lower, which is wonderful. Because of the success on the unit, we were asked to create a hospital-wide Clabsi reduction task force. This group meets and discusses any new evidence and best practice to make sure that we're keeping up with evidence-based practice. We review every Clabsi that happens in the hospital. The infection preventionists, clinical nurses, physicians, and nursing leaderships really does a deep dive into what happened to see if there's anything that we can learn from it, any trends, and then we share this with the staff. And we also work very closely with our nursing practice council to make sure that the nursing policy for central line care is updated and including most recent best practice. So this is just a visual of our Clabsi reduction on the unit. So you can see from November of 2016 through December of 2017, really high rate of Clabsis and a nice flattening out over the past almost 3 years, which we're very proud of. So in conclusion, having clinical nurses engaged in interventions to reduce Clabsis is imperative in promoting safety in hematology and stem cell transplant patients. It's important that clinicians are always conscious of the risk of infection associated with central lines, so continued education and conversations about central line care are essential. And lastly, I just wanted to finish with a picture of one of our celebrations on the unit. We try to really celebrate our milestones when we go a certain amount of time without a central line infection, really engage the staff in celebrating these great achievements.
Thanks, Laura.
Thank you.
That's neat. You know, the team actually looks really excited.
They were very proud of their work. They worked very hard.
They should have been. I turned on my video. I don't know if people could read my lips, but it was right as you were showing that graph. And I think I actually said, wow, that's quite a dramatic change. It's interesting because during one of yesterday's sessions, we talked about culture change and how it can be challenging when you change workflows. How did you get buy-in from the team?
That's a really great question. It's obviously very important to get buy-in from the team whenever you're making a big change on the unit. And I think one of the most important things for us was really having a few key staff nurses that were champions of this, that really were engaged and promoted all of the changes and the education. And it just spreads. Their enthusiasm and passion for making sure our patients are safe really is now a part of the culture on the unit, and everybody takes ownership of our patients and the care that they receive. So really embedded in our unit culture at this point.
Yeah, that actually made me think, like, how do you determine what milestones to celebrate? Did that come from leadership or from the team? And how did you decide, you know, when to celebrate?
That's a good question. So at the beginning, when we had so many infections, we really were celebrating any milestone. You know, we made it a month, we made it 3 months. And then as we started getting a little further out, we kind of focused on the bigger milestones. So a 6-month milestone, 1 year was definitely a big milestone. I think we had a cake for that one. But even just a little gathering where we can come together and say, you guys worked really hard, your hard work is paying off, even if it's just for a couple of months. At that time, that was a big achievement for us.
Makes sense. Plus, it allows you to get some continuous encouragement as things are progressing.
Exactly.
You know, another thing I'm thinking, so often things like this, you wonder, you know, do the patients understand and do they see and sense a difference? Do you have a sense of whether this helped with patients understanding what was happening, or patient satisfaction, or anything in terms of sort of general broader patient impact?
That's a good question. I would think that especially the patients who have been in before would have noticed a difference, more diligent care, and noticing that now there were 2 nurses coming in to do their dressing change instead of 1, and may have asked, why are we now doing it this way? And again, the nurses were excited about this and really happy to educate the patients on why we do the things that we do. So I think that there could have been a difference for the patients, especially for the ones who had been coming and knew how it was before.
It makes sense. Let me just pull up my Q&A and see if we have any other questions from the audience here. I think we're good. Thank you so much. This is really fascinating work. And I know this is an area where folks often face challenges, not only moving the needle, but then keeping the needle moved.
Yes,
yes, it's the one that sort of requires constant vigilance. And it looks like you guys have not only made a change, but you've been able to sustain it. So yes, great work there. Thank you so much.
Great. Thank you.